If you take blood pressure medication and you take it in the morning like 90% of people do, I have news for you. You might be making the single most dangerous mistake of your entire day. And it's not your fault. Your doctor probably never told you. Because until recently, even the experts didn't fully understand the hidden risk of timing. Here's what they didn't tell you. Most heart attacks happen between 6 and 10 o'clock in the morning, not at night, not in the afternoon, right when you wake up. Your blood pressure naturally surges during those early hours. It's called the morning surge. And if your medication has already worn off from the night before, your body is unprotected during the most dangerous window of your entire day. But here's the good news. A simple shift in when you take your pill, just moving it from morning to bedtime, can cut your risk of heart attack by nearly half. Half. That's not a small number. That's a life-changing number. I'm Dr. Sarah Carter, and I've spent years studying how small daily habits can dramatically change your health outcomes. Today, I'm going to show you why timing matters more than the drug itself. I'll explain the science behind the morning surge, why nighttime dosing works better, and I'll even reveal one simple test you can do at home to see if your current schedule is putting you at risk. But before we dive in, I want you to do something important. Subscribe to this channel and turn on all notifications. Why? Because I'm going to be sharing more of these hidden secrets that your doctor may not have time to tell you. And I don't want you to miss the next one. Also, leave a thumbs up if you or someone you love takes blood pressure medication. It tells me this information matters to you. Now, let's talk about the morning surge. Think of your blood pressure like a river. At night, while you sleep, the river runs slow and calm. Your body is resting, your heart rate drops, your vessels relax. But the moment you wake up, even before you open your eyes, your body releases a flood of stress hormones: cortisol, adrenaline, norepinephrine. These hormones are designed to get you ready for the day. They narrow your blood vessels, increase your heart rate, and push your blood pressure up by 20 to 30 points in just a few minutes. This is normal. It's called the morning surge. For most people, it's harmless. But for someone with hypertension, that surge can push already stressed vessels over the edge. That's when a plaque can rupture. That's when a clot can form. That's when a stroke or heart attack happens. Now, here's the problem with morning dosing. If you take your medication at breakfast, it takes about 1 to 2 hours to reach peak effect. That means, during the most dangerous window, the first hour after waking, your blood pressure is still spiking and your medication hasn't even kicked in yet. You're essentially unprotected during the exact time your body needs protection most. But if you take the same medication at bedtime, something different happens. By the time you wake up, the drug is already at full strength in your system. It blunts the morning surge. It keeps your vessels calm, and your body stays protected during that critical window. I want you to think about this for a moment. How many mornings have you woken up feeling dizzy, or with a headache, or just off? That could be your blood pressure spiking, and you had no idea. Now I have a question for you. Write in the comments below, what time do you currently take your blood pressure medication? Morning or night? I want to see how many of us are making this mistake without knowing it. Don't be shy, just type morning or night in the comments. It helps me understand what you're dealing with. Let's move forward. Because the science is clear. A massive study called the Hygieia chronotherapy trial followed over 19,000 patients for more than 6 years. The results were stunning. Patients who took their medication at bedtime had a 45% lower risk of cardiovascular death, a 40% lower risk of heart attack, and a 49% lower risk of stroke compared to those who took it in the morning. Those numbers are not a coincidence, and yet most doctors still prescribe morning dosing. Why? Because it's convenient, because it's what they've always done, because the drug companies never tested for timing. They tested for dosage, not for when you take it. But here's the truth. Your body doesn't care about convenience. Your body cares about rhythm. And when you align your medication with your body's natural circadian rhythm, you get better results. Now, I am not telling you to change your medication without talking to your doctor. I am telling you to have a conversation. Ask your doctor, would it be safe for me to switch to bedtime dosing? For most people, the answer is yes, especially if you take a long-acting medication like an ACE inhibitor, an ARB, or a calcium channel blocker. These drugs last 24 hours, and taking them at night still covers you through the next day. But there is one exception. If you take a diuretic, a water pill, bedtime dosing might not be a good idea, because you'll be running to the bathroom all night, and that disrupts sleep, which raises blood pressure even more. So for diuretics, morning is still best. But for most other classes, the evidence is clear. Night is better. Now, here's something even more surprising. In the next part of this video, I'm going to reveal the one simple test you can do at home to check if your current schedule is working or failing. It takes less than a minute, and it could save your life. But I'll save that for just a moment. First, let me remind you. If you are finding this helpful, make sure to subscribe to my channel. Every week, I share new, practical tips and home remedies for vitality. Join our community now by clicking the subscribe button below. And now, let's move on to the most common mistakes people make when adjusting their medication timing. Let's talk about the most common mistakes. I see them every single day in my practice, and they can completely undo the benefits of switching to bedtime dosing. Mistake number 1. Taking your medication with food when you shouldn't. Some blood pressure drugs, like certain beta blockers and ACE inhibitors, work better on an empty stomach. Others, like some calcium channel blockers, need food to reduce stomach upset. But here's the problem. Most people don't check. They just swallow their pills with dinner or a bedtime snack without thinking. If you're taking a medication that should be taken on an empty stomach and you eat with it, you could reduce its absorption by up to 40%. That means you're getting a weaker dose and your blood pressure stays higher than it should be. So before you switch to night, ask your pharmacist, does this medication need to be taken on an empty stomach or with food? It's a simple question, but it makes a huge difference. Mistake number 2. Inconsistent timing. I see this all the time. People take their medication at 10 p.m. one night, midnight the next, and 8 p.m. the following day. They think it doesn't matter as long as they take it sometime in the evening. But it does matter. Your body's circadian rhythm is precise. If you take your medication at wildly different times, your blood pressure levels will fluctuate just as wildly. You lose the protective effect of that nighttime dip. So pick a time, say 9 p.m., and stick to it within a 1-hour window every single night. Set an alarm if you have to. Consistency is key. Mistake number 3. Forgetting to monitor. When you change your dosing schedule, your body responds. Your blood pressure might drop more at night, which is good, but it could also drop too much, especially if you're on a high dose. That's why you need to check your blood pressure at home, not just in the morning, not just when you feel dizzy. Check it at bedtime, an hour after you take your medication, and again first thing in the morning. Write it down. If your morning reading is consistently below 110/70, that's a sign your dose might be too high for nighttime use. Talk to your doctor about adjusting it. Don't just stop the medication, that's dangerous, but do monitor and communicate. Mistake number 4, ignoring how you feel. Some people feel lightheaded or dizzy when they first switch to bedtime dosing. That's not unusual. Your body is adjusting. But if that dizziness persists for more than a few days, or if you feel faint when you stand up, that's a red flag. It could mean your blood pressure is dropping too low at night and your body isn't compensating properly in the morning. Again, talk to your doctor. They may need to lower your dose or adjust the timing slightly. Now, here's the most important mistake of all. Assuming that once you switch, you're done. You're not. Your blood pressure changes with age, with weight, with stress, with the seasons. What works today might not work 6 months from now. So you need to keep checking, keep adjusting, keep having those conversations with your doctor. This isn't a one-time fix. It's an ongoing process. But here's the good news. When you get it right, the results are remarkable. Patients tell me they sleep better. They wake up with more energy. Their morning readings drop by 10, 15, even 20 points. And most importantly, they reduce the risk of heart attack and stroke. That's not just a number on a screen. That's a longer, healthier life. Now, I promised you a simple test you can do at home to check if your current schedule is working. Here it is. It's called the Morning Surge Test. Here's what you do. For 3 consecutive mornings, take your blood pressure immediately after waking, before you get out of bed. Then, take it again after you've been standing for 2 minutes. Write both numbers down. If your standing reading is more than 15 points higher than your lying reading, that's a sign of an exaggerated morning surge. It means your blood pressure is spiking dangerously when you stand up, and your current medication schedule might not be protecting you during that critical window. If you see that pattern, share it with your doctor. It's a strong indicator that bedtime dosing could benefit you. I'll say it again. This test takes less than a minute, but it could save your life. So try it this week and let me know in the comments how it goes. Write "test done" or share your numbers. I read every single comment and I want to hear from you. Now, let's move on to something even more powerful. In the next part of this video, I'm going to show you 3 natural strategies that work alongside your medication to lower your blood pressure even further, without adding a single pill. These are things you can start doing tonight while you sleep. Stay with me. Let's talk about the first natural strategy. It's something I call the potassium reset. And I want to be very clear about what I mean, because this is where most people get it wrong. They hear potassium and they immediately think of bananas. But bananas are not the answer here. In fact, if you're over 50 and your kidneys aren't what they used to be, eating too many bananas can actually be dangerous. So what do I mean by a potassium reset? I mean increasing your intake of potassium-rich vegetables, specifically leafy greens, avocados, and sweet potatoes. These foods are packed with potassium in a form your body can use safely, without the sugar spike you get from fruit. And here's the science. Potassium helps your kidneys excrete sodium. It acts like a natural diuretic, flushing excess salt out of your system. When you reduce sodium, your blood vessels relax. And when your blood vessels relax, your blood pressure drops. It's that simple. But here's the catch. Most people over 50 are potassium deficient. Not because they don't eat enough bananas, but because they take medications that deplete potassium. Diuretics, beta blockers, even some over-the-counter pain relievers can strip potassium from your body. So if you're taking blood pressure medication and you're not actively increasing your potassium intake, you're fighting a losing battle. The solution? Add half an avocado to your dinner, or a cup of cooked spinach, or a baked sweet potato with the skin on. Do this every single day for 2 weeks and I promise you, your numbers will change. And here's the best part. You don't need a prescription. You don't need a supplement. You just need to change what's on your plate. Now let me pause here and address a common concern. Some of you might be thinking, but Dr. Carter, I have kidney disease. My doctor told me to avoid potassium. If that's you, please listen carefully. This advice is not for you. If you have advanced kidney disease, you need to follow your doctor's instructions strictly. But for the vast majority of people over 50, a mild increase in dietary potassium is not only safe, it's essential. If you are unsure, ask your doctor for a simple blood test. It's called a basic metabolic panel. It will tell you exactly where your potassium levels are. If they're low, you have your answer. If they're normal, you can safely increase your intake. Either way, knowing is better than guessing. Now, let's move to the second natural strategy. This one is even more powerful, and it involves something you already do every single night. I'm talking about your breathing, specifically how you breathe while you sleep. Most people don't realize this, but the way you breathe at night has a direct impact on your blood pressure the next morning. If you're a mouth breather, if you snore, or if you have sleep apnea, your blood pressure is likely spiking every single night without you even knowing it. Why? Because when you breathe through your mouth, your airway collapses, your oxygen levels drop, your brain panics and releases stress hormones. Those hormones constrict your blood vessels and raise your blood pressure. It's a vicious cycle. And the worst part? You're asleep. You have no idea it's happening. But here's the good news. There's a simple fix. It's called nasal breathing. And I'm going to show you exactly how to train yourself to do it, starting tonight. First, before you go to bed, take a piece of medical tape. Yes, the kind you can buy at any pharmacy, and place a small strip vertically over your lips, just enough to keep your mouth closed while you sleep. Do this for 1 week. I know it sounds strange, but I've had patients tell me it changed their lives. Their snoring stopped. Their morning headaches disappeared, and their blood pressure dropped by 10, sometimes 15 points. Why? Because nasal breathing forces your body to produce nitric oxide. Nitric oxide is a molecule that relaxes your blood vessels. It's like a natural vasodilator. And when you breathe through your nose, you produce it in abundance. When you breathe through your mouth, you don't. It's that simple. So tonight, try the tape. And if you're worried about safety, start with a small piece. You can always remove it if you feel uncomfortable. But give it a real try. Do it for 7 nights and then check your morning blood pressure. I guarantee you'll see a difference. Now, before I reveal the third strategy, I want to remind you to subscribe to this channel. If you're finding these tips helpful, hit that subscribe button and turn on notifications. I release new videos every week, and I don't want you to miss a single one. Plus, when you subscribe, you're telling YouTube that this content matters. That helps me reach more people who need this information. So please, take a second and do it now. I'll wait. Now, let's move on to the third strategy. And this one is probably the most overlooked. It's about when you take your blood pressure medication. Most people take it in the morning, right after breakfast. But here's the truth. That might be the most dangerous time. You see, your blood pressure naturally dips at night while you sleep. It's called nocturnal dipping. Then, in the early morning hours, it surges. This morning surge is when most heart attacks and strokes happen. So if you're taking your medication in the morning, you're treating the problem after the danger has already passed. The better approach? Take it at bedtime. Studies show that nighttime dosing can reduce cardiovascular events by up to 45%. It aligns your medication with your body's natural rhythm. Of course, always check with your doctor before changing your medication schedule. But if you can, ask about switching to bedtime dosing. It's a simple shift that could save your life. Now, here's the fourth strategy. Watch your salt, but not the way you think. Everyone says cut salt, but the real problem isn't the salt shaker. It's hidden salt in processed foods. Canned soups, deli meats, frozen dinners. These are sodium bombs. One bowl of canned soup can contain more salt than your entire daily limit. So instead of avoiding salt altogether, focus on whole foods. Cook from scratch. Use herbs and spices for flavor. Your taste buds will adapt in just 2 weeks, and your blood pressure will thank you. Finally, the fifth strategy. Move your body, but gently. You don't need to run marathons. A 20-minute walk after dinner can lower your systolic pressure by 5 to 8 points. The key is consistency, not intensity, just a gentle daily rhythm. So let me summarize. First, time your medication correctly. Second, tape your mouth at night. Third, eat whole foods. Fourth, walk daily. And fifth, always consult your doctor before making changes. Now, here's my final thought. You are not a victim of aging. Your body wants to heal. It just needs the right conditions. Give it those conditions, and you can take control of your health. No more handfuls of pills. No more fear. Just simple, powerful changes. If this video helped you, please share it with someone you love. Send them the link. And don't forget to subscribe and hit the bell. I'm Dr. Sarah Carter, and I believe in you. Take care of yourself.